Hi, everyone. Welcome to this edition of the CHP Spotlight Interview Series. I am so excited today because we have a twofer. We have two people here. We have Dr. Danielle Miro, Dr. Kelly Donahue, and this is really exciting for me because, and I've explained this, Danielle and Kelly, to you separately about just the need for more help of people that have chronic pain and that come to see us in physical therapy in regards to more of the mental health side of things. And so I was so excited to have you all here today so that I can learn more, so that everybody out here can learn more. And first I'll start with you, Dr. Danielle Miro. You're a board certified rehabilitation psychologist. Dr. Miro has interest and expertise in helping people adjust, adapt, and recover from serious medical illnesses, rehabilitating from orthopedic and neurological injuries, and working through chronic health conditions, including chronic pain and weight management. Dr. Kelly Donahue, she's a clinical health psychologist and mind-body change expert. Her private psychology practice started 15 years ago. Congratulations. Specializes in areas of anxiety, stress, depression, weight loss, and chronic health conditions, to include chronic pain. And now on the sheet I'm reading off of, there's a lot more here, but we're going to find out more about both of you as this conversation goes on. So to kick things off, I'd love to hear a little bit more about, and we had discussed this, but I'd love to hear about, for everybody listening to this, just where your practices such as yours, and I know there's some differences between the two of you, fit with somebody who might be in physical therapy or just in the healthcare system in general, experiencing chronic pain. So feel free to, whoever wants to take that one and start, roll with it.
Sure, I can jump in. So I think that, well, my bias is that psychologists could always be beneficial and helpful in matters, especially with chronic pain. But I think more often than not, our experience is that we become the doctors of the resort doctors, the doctors of last resort. So after clients have not been able to heal their pain in the way that they would like to, or recover from injury in the way that they would like to, eventually the practitioners that they're working with, especially if they're sort of insightful and informed, will say, hey, why don't you, maybe this is more than just physical stuff going on here. Why don't you go see a psychologist? And I think to some extent, the stigma around that is slowly starting to shift. I know Danielle and I work with a lot of clients, and we think that, again, earlier is probably better. But when we get clients, they're often really frustrated because they haven't seen success in the traditional realm. And sometimes they think, oh gosh, does that mean there's something wrong with me? Or somewhere along the way, a misinformed practitioner will say something to the effect of, maybe it's in your head, or maybe you need an antidepressant or something like that. And those things depression can definitely be part of it. We're going to get into that later, I know. But I think that there's a lot of ways in which we can help at different points along the way.
And to piggyback, I think, off of what Kelly said, at our core, our brains and our bodies are connected, which means they're going to interact. To think that my leg muscle or my back that I'm rehabbing or recovering on is independent of my brain and its communication, sometimes we forget that. And so as our brain is really adaptive and really plastic to learning new things, sometimes pain becomes something that is also kind of picked up by our brain, where we kind of understand that although the immediate injury might have healed, that we understand that these connections and pathways in our brain really can be primed to have pain. And so learning how to cope and learning how to think and learning how to adapt are some really great strategies and kind of starting places in counseling and therapy, especially for persons with pain. I think even kind of further to what Kelly said, we oftentimes are the last resort. And so meeting people earlier on and kind of developing different strategies is really a really great asset. And being able to work with other providers and other people on their team also lends itself really well to help make sure that we're getting that kind of comprehensive, holistic care.
God, I love that perspective. It's such a unique way, and I think helpful way to be able to think about that. And Danielle, to piggyback on something you said, you mentioned to finish your comment there was on like holistic care, and I know it's not often thought of this way, but I think many times it's important to have a collaborative relationship in the healthcare world, if you will. More people working together. And I often see that when people have an orthopedic injury as an example, because that's just my bias and what we see a lot of, they often think to go to their orthopedic surgeon maybe first, or to their general physician, or, sometimes their physical therapist in our case, first. And oftentimes, it's just not a thought for many of them to go see somebody in this more psychology or mental health sort of space. So when what is the right or what is the best time to come see somebody such as yourself in that overall sort of journey, if you will?
I think the earlier the better. I think we understand that pain is not isolated in its own self in the same way that we experience pain. It extends and kind of branches out into other areas of our life, especially when people are living with chronic pain, understanding how that influences our relationships, our physical health, our sleep, our eating, other aspects of what we do and how we feel. Psychology is a really great kind of starting place to help people adapt and learn and find new ways of being or trying on different things. And I can let Kelly kind of go further into that with some experience.
No, those are excellent points. And I think, one of the big things is that Danielle mentioned is that it affects every area of life. Any sort of chronic pain issue or orthopedic issue, it changes your whole world and every facet of life. So the things that you may normally have done, like let's say you were a soccer player and that was really helpful for your mental health. Now suddenly you're not playing soccer, and how are you kind of managing to get your mental health under control, or how are you improving your mood if that's gone away? So I think that's an area where we can really be helpful, is really trying to come up with some strategies and look at this very practically, right? So a lot of this stuff is lifestyle factors, and how can we change the way you're eating maybe to optimize healing. With orthopedic issues, with pain issues, there's a lot of inflammation that happens naturally as a part of healing, but often stays there too. And the research shows us now there's strong ties that show us that inflammation is a huge part of depression. So what things can we do from maybe a stress management perspective or a psychiatric nutrition perspective that can help reduce inflammation, that can help the body overall, to include pain and orthopedic issues?
I love that, and I'm gonna even ask more questions about what you just said, Dr. Donahue, because one of the myths I often hear from people, because especially when on our end we suggest to some patients of ours that maybe it might be helpful for an expert in this area to be part of your team. Many people often, right, you said the stigma is getting better, which I agree with, but right, is there still something there? And many times I've heard that people feel it's not necessarily based on the science as much as maybe like having a surgery might be, as an example. And I'd love to hear just a little bit more about that from the both of you, just that we can, I know there's tons out there, we can make this super complex, but just to, in layman's terms, just for, just the average person, for myself, if you might lose me if you go too crazy, but just that people can know, to understand that, no, this is not like some sort of foo-foo stuff way out there. This is like real science-based things that can help you to get over the pain that you're in. Hopefully that helped.
Yeah, no, I can jump in there. So I want to say that research has come a long way. And I think that's indicative of how the stigma is coming along too. I think those things probably go together a little bit. And there's a lot of research out there now in peer-reviewed literature, meaning not just someone's blog somewhere that tells you to do something, but in these really high prestigious journals that are under a lot of scrutiny and produce high quality research studies. So one of the ones I'm most excited about just appeared in JAMA Psychiatry. And that is a big journal. Like, that is a really powerful journal. And what they found was that this sort of newer therapy for helping people with chronic pain, called pain reprocessing therapy, had really, really beneficial effects compared to a control group, such that people were not experiencing pain immediately after the treatment, but then again, like a year out, they still weren't experiencing the pain, which, you know, anyone with chronic pain knows there could be good days and good moments, but it often comes back. And so to have a study that showed us that just from rewiring, relooking through psychology, how we interpret sensations that we feel in our body as pain sensations, how reinterpreting them can lead us to feel better. And that's pretty powerful. That's just one example of a recent study. And I know Danielle is familiar with the literature too.
Yeah, one of the best resources I love to tell people, psychology moves so fast and there's so much changing. You know, one of the coolest kind of opportunities to see as a psychologist is also looking at from like the VA, the Veterans Affairs Administration, of kind of some of the research they put out. They have kind of created these programs that are whole body focused for persons with chronic pain. They're finding that when we begin to tend to not just the physical health, but to the dietary health, the physical activity, our social health, our mental health, that really kind of incorporating all of these types of aspects produces better outcomes. You know, I think with pain, the challenge that becomes is kind of in that traditional medical model where we're trying to cure pain. When we think about it from a biopsychosocial perspective, really kind of incorporates that, you know, us as people, we're part biology, part psychology, and also part socially. We exist in many different facets. I think one of the biggest challenges is how do we learn to live with pain? And I think psychology has really kind of translated some of that research into evidence-based practice. If you hear that word thrown around, it just means it has good research behind it, that we're really helping people finding ways to move and live with pain, and actually finding that they have less pain after they do some of these types of therapies like cognitive behavioral therapy, acceptance and commitment-based therapy. So there's a lot of really good opportunities and research out there that shows this can be helpful.
I love that. That's so helpful to hear, even for me to hear about. Just, hey, there's a lot of research on this that shows the benefits. And because, right, I've always found that I think one of the challenges I know when we refer for something like this is people can, right, you can see your arm, you can see your shoulder, but you know, most people don't see what, you know, is happening in their head, right? And it's hard to see the interactions of how everything works together. And so it's so helpful when you can point to say, hey, no, there is real stuff that's out there that is tangible. And Danielle, you had mentioned some specific areas of the field, such as cognitive behavioral therapy and others. Would either one of you would you mind shining some light on some of these areas and maybe in a nutshell what some of them mean? Because frankly, I mean, I'm a medical provider and I don't really know, so I'd love to hear it.
Hallie, I think you lead the group on this, and it would be a fantastic description of what you do.
Sure, absolutely. We definitely have a holistic perspective, and we understand that each person is individual. So every person who comes to us with a diagnosis of depression or pain, they have a whole different history from someone else. So therefore, what helps one person is probably not going to help the other person. And I think that's why it's really important to have a holistic integrative approach so that we can use all of the different modalities that we've been trained in and sort of pull what works from our toolbox to help an individual. Now, having said that, we know that there are a lot of kind of gold standard treatments for things like anxiety, depression, and pain. And one of those is cognitive behavioral therapy. And I like to use a model of that called the TEB model, just to kind of keep it really simple. And the idea behind cognitive behavioral therapy using that model is that T, our thoughts, influence E, our emotions, which lead to our behaviors. So oftentimes, if you're working with a provider, let's say they're working with you, Zach, and you want them to do 10 reps of something, that's a behavior. But if they're not able to do that consistently, and you're like banging your head against the wall, why is this not happening? Instead of just focusing on that behavior and trying to get that to change, we need to kind of look back up the chain and understand, how are they feeling? Are they feeling defeated and unmotivated? Is that why they're not able to do that rep? And if so, what are they thinking? What are they telling themselves that's making them feel that way? And once we can identify what's going on there, we can often modify the thoughts. Just having awareness of the thoughts starts to change it. But once we can modify the thoughts, we can change how the person feels and then get to a different behavior. So I'll give you a brief example, and this is something that we are using in the pain reprocessing therapy ideas too. So if someone comes with pain, they may have a sensation. So let's say they have a twinge in their back. I am a chronic back pain sufferer, come a long way in that, but I'm familiar with this twinge in the back. So oftentimes if we get this twinge, our immediate thought would be like, oh no, this is the worst. Here we go again. I'm going to be flat on my back all weekend. That leads you to feel fear and anxiety. And then you're probably going to tense up even more and isolate and not move your body. And then that probably is going to lead to more pain. So that's an example where that TEB can have a negative outcome. And that sort of feeds the whole cycle because you're not feeling good. So then you start thinking, oh, this is the worst. I'm never going to feel better again. So what we would do is say, is there another way to look at that same circumstance? So we feel a sensation. Instead, could we say something like, there's that sensation again. You know, this has happened to me before, and I know I can get through it. It's going to take a few deep breaths and take a moment. And when you say that to yourself, you're likely to feel more reassured. You're likely to feel a little less stressed. And when you feel less stressed and less anxious, you're likely to, the behaviors are going to be more relaxed in your body, which is going to kind of deactivate those pain signals and hopefully create that positive cycle where you're then not experiencing as much pain.
Got it. That's super, super helpful. Yeah, thank you so much for that elaboration there, because that kind of actually puts it into almost like more of a, you can almost picture almost now what it might look like or what the process is actually like. Because I know that is always a challenge, because they're like, well, what are they actually gonna do, right, when I go? And you know, a lot of times my answer is, I don't know, that's not what I do. But even just being able to speak to it on just a very simple level and having an understanding out there is helpful. So no, I appreciate that. And then, you know, Danielle, I'm curious, you know, for you, obviously, if you have anything to elaborate on that, please feel free to add that in. But I'd love to hear even more recently, just getting into a more specific example. How have you seen your practice change and some of what many of us out here are still experiencing on the mental health side of things as it relates to the pandemic, where I guess still in. So, you know, I'd love to hear just sort of how your experience has been as a professional during that time.
Yeah, I think it's been kind of a continuum where there's been a lot of movement. I think the kind of the isolation aspect has really increased our use of telehealth, which has been great in moving us forward, learning that we can adopt different types of therapies or techniques, whether it be PT or OT, even counseling, therapy, medical visits into this telehealth modality, which has been great because I think it increases our access to care and increases our continuation of things that people had been working on pre-pandemic. You know, with the pandemic, I like to remind people that we're all feeling the stress and feeling very vulnerable with the uncertainty of things that are coming and what we're hearing and what we're learning, because it's been such a change every day or every few days. You know, when you think about a bathtub, there's kind of two ways in and out. There's water coming in and water going out. You know, generally as people, our body is pretty good at maintaining a level in that bathtub where water goes out because we do things that are relaxing, fulfilling, help us feel better. And maybe that faucet feels like it's just on a small trickle or a small drip. You know, when we think about the body in that way, our body's ability to respond to stressors is fantastic. You know, looking at how our body moves, how it heals, how it defends itself. What I've noticed with the pandemic is it seems like people's bathtubs are just a little bit more full. And at some point, if we don't have an opportunity to let water out of those bathtubs, they overflow. And I think that blends in really well with pain in particular, because pain is so primed by our physiological arousal system, you know, and kind of the medical terms, you know, thinking about your autonomic nervous system, which means that your body is more primed and more prepared to be on guard and be very aware. You know, over time, although our body adapts to that, it becomes very tiresome. And like I said, that bathtub gets even fuller. So it might not take much to turn the faucet on or to have water kind of pour out. With pain in particular, if my body is very tense and very anxious, or feeling very terse. I say, if you look down at your hands, are you holding them in fists or are they nice and relaxed? That I've worked with a lot of patients where we're understanding the intersection that the pandemic has really added a layer of uncertainty and tension that maybe wasn't there before, and kind of understanding how that relates to their pain, I think is really foundational. Because when we're able to identify, like Kelly mentioned, stress management techniques, responding to our thoughts and our feelings in different ways, it might not take all the pain away, but it might allow us to respond differently and come at it from less of a protective on guard stance to one that's more mindful and aware and adaptive to our pain. And so I think in the pandemic, that being the biggest thing, recognizing that we're all going through this uncertainty and unsure period, and being able to connect that to our pain management or our sleep or our behaviors is really important.
Gotcha. That's super, super helpful. I love the way you put that, Danielle, actually. And I swear for anybody watching this, I did not tell her to use that example, because the reason I say that is anybody who's worked with me before knows I like to use the glass analogy of the water overflowing. So I heard the bathtub version and I was like, wow, that's awesome. And it's so helpful, because I think like you're so right. There's all this, any stressor in our lives fill up that tub in this case. You're right, a little bit, and there's only, we can try to take some water out of that tub, so to speak, in our physical therapy setting in my case, but as we mentioned earlier on, I think the human organism is so complex. We're all so complex as human beings. There's so many things that influence our health and wellness and all kind that we don't even realize in many cases. And so there's only so much that we can really do in one specific setting sometimes in our cases. And we've noticed that as well amid the pandemic, is that, just kind of get the sense like people are, dealing with a lot more, understandably. And so, right, if we can address something else that's going to also help produce results in our setting, I mean, that's just so helpful. So I really appreciate that analogy. Now, I know all of you have places to be, you're busy, but Kelly, Dr. Donahue, is there anything else you wanted to add to anything Danielle said? I saw you shaking your head, so I wanted to make sure I didn't talk over you as well.
Oh, I think, everything Danielle said, I echo 100%. And just to reiterate the importance of the mind-body connection, to help people understand that pain is a neurophysiological experience. And as Danielle said, it affects the nervous system, the autonomic nervous system. And our neurons that fire together, wire together, which means when we've had months and weeks and even years of practice of wiring and firing together on pain signals, that's going to be our default method for interacting in our brains. When we have a sensation, that's the default pathway that our neurons are going to use. Now, if we add some stress, say 2+ years of a pandemic, we revert to our most well-practiced behaviors. So that means it's going to be even easier. We're even going to be more likely to use those pathways that have been wired and fired together for pain. So when we create new pathways through thinking differently, through processing and interpreting signals in our body differently, we have to practice those. So in my example of the cognitive behavioral therapy example, seemed pretty straightforward and pretty easy. And it is, but it requires a lot of practice. And we know that we can change the neural connections in our brain, the preferred ones, with two things: repetition and positive emotion. So when we can practice these new thoughts and notice how these thoughts make us feel and take a moment to feel into that, we're going to be more likely to change those behaviors. Our brain is always looking out for us. It's in survival mode, but it's always looking for the negative. So it's going to be scanning and it's going to be ready to say, oh, there's a pain sensation. That's the worst thing. We have to prepare for this right away. So we have to kind of reduce the stress overall, like Danielle was saying, reduce the level in that bathtub, and then think of how can we rewire this. And when we're in that state where the bathtub water is down a little bit, we can learn better and we can come up with new ways to think, new ways to experience our emotions, to allow ourselves to process emotions so that we don't have to have the pain express as a way to process emotion. So that's kind of another tangent about pain in terms of emotions. having a biochemical kind of imprint in our body. And when we store emotions for too long without expressing them, that itself can contribute to pain. So the biopsychosocial model, biology, psychology, how we interact with one another, it's all really important.
Wow, thank you so much for sharing that. I mean, I learned a lot from just hearing that, those examples, and the way you both are able to take what I do know are very complex topics and very complex answers to the questions I ask and make them understandable. Is super, super helpful. So no, I appreciate that. And as I mentioned, I know both of you, have very busy schedules, and it's always tough to get, both of you on a call at one time. So I don't want to overstep what time you have available, but I would love to hear, finally, just to wrap things up, just for anybody listening here, what is the best way for them to be able to reach out to you, to find out more, you utilize your help if anybody so desires?
Online, please reach out to our website, which is dchealthpsychology.com. We offer kind of profiles about all of the providers in our practice, as well as different resources like groups and different kind of educational opportunities that Kelly can probably describe a little bit more.
Sure. So as Danielle mentioned, if you're interested in working one-on-one with us, dchealthpsychology.com is a great place to start, and you can reach out to us through email or phone there. And then we have a website called modernpsychologist.com, and there you can learn more about the groups and courses that we offer. I just finished up a course in chronic pain, and I'm now recruiting to run an ongoing support group that will meet twice a month to talk about how pain affects us and to talk about some of these strategies that we've mentioned here today.
Awesome. And for anybody watching this, there is a link below this video, especially if you're watching it on YouTube. I want to make sure that there's those resources available to you. If you're watching this through the newsletter, those links will be in the newsletter as well. So first off, Dr. Miro, Dr. Donahue, thank you so much for joining us today. I got a ton out of this, and I know everybody else watching did. So thank you. I appreciate it.
Thank you so much for having us.
Thank you.